Have you ever had people come up to you and say that cholesterol is so bad for you? And did you actually wonder if they were being truthful or not? Hi there, my name is Bokamoso Mthmkulu and welcome to my YouTube channel. Technically, cholesterol can't be all that bad because it has specific functions that it needs to perform in the body. Firstly, it forms as part of our cell membrane structure. It produces reproductive hormones. It promotes efficiency in our metabolism. And lastly, it helps in producing bile acids, which is important for breaking down food and absorbing that nutrients that the body needs. So it can't be all that bad, right? Wrong. You see, our bodies love balance. And so having cholesterol to follow out its functions is good. But when cholesterol is too much in the body, then there is a problem. Or rather, when it's too much in the blood, then there is a problem. So what that is known as is hyperlipidemia. This is just an increase in your cholesterol in the blood that can cause damage to your vessels and lead to cardiovascular diseases as well as stroke. So today, what I want to do is provide you with more knowledge on what high cholesterol is, what happens to the vessels when you have high cholesterol, how it is diagnosed, and what you can do to help manage your high cholesterol if you have it. Please do note that this is only for educational purposes, and if you have any concerns, do seek professional medical advice. Also, don't forget to like and share this video to as many people as possible so we can reach as many lives as possible, and to subscribe to my channel if you wish to see more videos like this. Now let's jump right into it. So what is hyperlipidemia? This is an increase in your fasting blood cholesterol or triglyceride levels. It is fat soluble, which means that it cannot travel in the blood on its own. And so triglycerides, cholesterol, and other substances generally attach to an apoprotein, and it is once it has attached, it is called a lipoprotein, and then only can it travel in the blood to where it is needed in the body. You have three main types of lipoproteins that travel in the blood. Your VLDL, which is also known as very low density lipoprotein, your LDL, which is low density lipoprotein, and your HDL, which is high density lipoprotein. All of these lipoproteins carry triglycerides and cholesterol as well as other substances. So VLDL is made within the liver itself, carrying your triglycerides, cholesterol, etc. But its main content is triglycerides. Your triglycerides in this VLDL is carried to a different part of the body through the blood, and it is used for whatever it's needed at that specific time. Once the triglyceride has been delivered to another tissue in the body, then its main content of that lipoprotein is cholesterol, and that is known as LDL, or bad cholesterol. So this bad cholesterol is allowed to travel in the blood and roams around and can cause a bit of damage to the vessels if it ever does so. Whereas your HDL, what that does is it's known as good cholesterol, because what it does is it takes that cholesterol that is found in the blood that is excess back to the liver, where it is excreted or used for other processes like said before. So these are the three main types of ways that you will find cholesterol in the body, and your LDL is what you want to have a low amount of compared to your HDL. So now let's look at its pathophysiology, which is basically what it does to the body and how it can damage the processes that normally happen in the body. As you can see here, that LDL cholesterol, bad cholesterol, is not the only thing that can really cause damage to your vessels. Other things such as hypertension, free radicals from smoking, genetic alterations, type 2 diabetes can also cause damage to your blood vessels. And what happens is that all these different factors, as well as elevated LDL, causes endothelial dysfunction. So what the endothelial is a specific inner layer of your blood vessel, which is made up of a few layers. Now, this layer allows for no toxins to enter into or in or out of the blood, as well as to any damage to happen further within the blood vessels. But when there is a dysfunction, it means that it's not working optimally or not following through with its function. And it can lead to two specific things. Firstly, this damage allows for inflammation into that area, which causes more edema, which is fluid retention, as well as your white blood cells and platelets to adhere to the wall within the endothelium. Now, also because it's not working optimally, it allows for more toxins and pathogens, etc., to enter into that layer. And cholesterol is one of those things that can adhere or enter into that layer. What happens after that is that you have more inflammation that takes place and a long cascade of events that happens that causes your cholesterol to form a plaque and your platelets to form a clot. And as that continues to grow, it decreases the size of your vessel. So if you think of your vessel as a nice round circle, when that endothelial layer is damaged and your cholesterol and platelets, etc., can enter into it and form a plaque and clots in that area, then that lumen becomes smaller and smaller and smaller. And that is generally what you see in some of your cardiovascular diseases as a cause, as well as stroke. And that's how high cholesterol can lead to those two conditions. But what you need to note here is that you have that closing of the lumen. And with that closing of the lumen, it allows for less oxygenated blood to flow through and less optimal functioning of other tissues above or below where that clot or plaque is forming. Cholesterol has different cutoff points in how much is needed in the blood for it to be good and fine, for it to follow out its functions, and you want to try to stay below those limits. Now, in metabolic syndrome, the cutoff is that you don't want your cholesterol greater than 7 millimoles per liter. But generally, you want to keep it below 5.18 millimoles per liter to be 100% good. Now, this can normally be done with a simple blood test or similar to your glucose pricking machines. I'll try put a picture up for you guys to see what it looks like. You can either go to a clinic and get a nurse, or another specialty like a biokineticist or any other profession that can take this test for you. And it's a simple prick again, and what it does is similar to the glucose one. It just checks your cholesterol on a stick instead of a blood test, and it is slightly quicker and in the moment. And it takes your whole cholesterol level, not your HDL and LDL, and that you'll probably need to do a blood test for. So in terms of HDL, which is your good cholesterol, you want to make sure that that is more than 1.04 millimoles per liter in the blood. And then as well, keep your LDL less than 3.37 millimoles per liter in the blood. One of the most fascinating things that I've read is that your body produces cholesterol for its need. And so eating more cholesterol is not that necessary in order to have enough cholesterol in your body to do its functions, because your body does that for you already. And so a nice way to manage that, or a nice way to prevent that, is to limit your amount of cholesterol that you eat in general. And that would be by decreasing your saturated fats and your trans fats. These are your unhealthy fats and your processed foods in general. Then you want to increase your healthy fats, or your monounsaturated fats. So like your extra virgin olive oils, avocados, nuts, etc. And then the normal things, eating more fruits and vegetables, a low-fat dairy diet, etc. And then also what you want to do is you want to increase your omega-3 fatty acids, which is very important for the body. And you can generally find that in fish, mainly tuna is what it can be found in. But now most management can be just changing your lifestyle, but it works better when coupled with exercise and with medication if prescribed. So in terms of exercise, what you want to do is follow the normal ACSM guidelines, which I will show in a video coming up soon, is getting your aerobic activity to at least 150 minutes per week. That's about 30 minutes, 5 days a week. Or you can do a bit of a vigorous type of activity, 75 minutes a week. So that's 30 minutes for 3 days a week. Other things that you can do to try help with your increasing your heart rate and getting that moderate activity in is by doing strength activity and doing that 2 to 3 days per week and working mainly on your large muscle groups. So your legs, your chest, your arms, etc. These are just a few ways that you can try and manage your cholesterol if you have high cholesterol, as well as getting prescribed medication from your doctor if he or she recommends so. The nice thing about these is that it's also great ways that you can prevent getting high cholesterol by cutting out cholesterol before it gets too high, and by exercising and keeping healthy, making sure that your cholesterol is utilized correctly in the body. Now we are done with this lecture. I hope you guys learned something about this and got some knowledge. Some takeaway notes is that cholesterol is needed for the body and it is made by the body. So adding cholesterol in your diet is not necessary. If you do have high cholesterol, what you want to do is add some exercise into your routine, as well as decrease your amount of unhealthy fats specifically in your diet. If you want to prevent getting high cholesterol, also what you want to do is keep your exercise, keep your cholesterol consumption as minimal as possible. And don't forget to know your family history as well as your age, because these do play a role in what happens in your body, how your body reacts to certain things, and if you're prone to getting high cholesterol. So guys, thank you for tuning in. I hope that it did add some value into your life. And if you have any questions or you need me to explain anything, please just drop a comment down below. I'll get back to you as soon as possible. Don't forget to like if you found this video useful. Don't forget to share to maybe loved ones or any other family members that may find this information useful. And lastly, don't forget to subscribe to my channel so that you can see more videos like this. I hope you guys have a great week ahead, and I'll see you guys next week. Bye.